If you are a nurse or a licensed health professional building an audience online, there's a video that you need to know about, and not for the reason that you might think. A creator who investigates strange corners of the internet spent weeks inside of a network of AI-generated health influencers. Fake doctors, fake grandmothers, fake healers, and fake kitchens giving real medical advice to real people. Roughly 250,000 views later, he ended his video with a question that he openly admitted he couldn't answer. He said, "Is this stuff a cause for concern or is it harmless?" Well, he couldn't answer it because answering it correctly takes clinical training. I have 30 years of it, so today I'm going to answer him, and then I'm going to give you what this investigation means for you, because the line that those accounts crossed is the same line that your license has always asked you to hold. First, the short version of what he documents, because you need the context. The video is called "I Investigated an AI Health Slop Content Farm," and it's from a channel called "The Internet is Eating Itself." I've linked it below, and it's worth your time. He found an AI-generated character, a silver-haired man with glasses, turtleneck, bookshelves behind him, looks like a professor, sounds authoritative, at least until his accent changed mid-video. And this character posts health advice every single day. The account claimed that garlic, turmeric, and black pepper mean you will never have to go to a hospital again. It tells people with tonsil stones that their body is depositing what it cannot clear. And in the video that stopped me cold, it tells people struggling with alcohol addiction that turmeric, cinnamon, honey, and milk can recalibrate their craving signals. You just heard that the way that I heard it. Felt your skin crawl, didn't you? He kept digging, and it wasn't just one account. It was a network, different characters for different audiences, a grandmother for people who trust grandmothers, a back to the old ways healer for people who distrust Western medicine. Same recipes, same 10 ingredients, same claims on an industrial scale, several of them carrying affiliate links for supplements. One account that he documented had roughly 300,000 followers, and while he was still investigating, Meta took it down. There's one detail that he showed on screen that I want you to hold on to, because we're coming back to it. Some of these videos carried the platform's own warning. Creator labeled as AI generated. The label was right there. People watched it anyway. So his closing question was, is this a cause for concern or is it harmless? Well, here's the answer, and I want to give it to you in a way that I'd give it at the bedside, precisely. He spent weeks documenting what those accounts say, the recipes, the claims, the confident voice, and the question he kept circling was whether or not any of it does real harm. I want to answer a different question, not what's in these videos. Let's talk about what they leave out. The true danger is in what those videos displace. In everything that he documented, not one of those accounts ever told a viewer to see a real provider. Not once. Now picture who these videos actually reach. Someone with a drinking problem that they're ashamed to say out loud. Someone with a symptom that they're hoping is nothing. The video hands them false reassurance and a reason to wait. In nursing, we have a name for what happens next. It's called delay of care, and it's one of the quietest ways that people get hurt. Nothing happens, and then nothing happens, and then everything does. So no, it's not harmless. The harm was never about the cinnamon. The harm is in the sentence that comes after it, the one that tells a struggling person that they don't need anyone else. That's the clinical answer. Now here's the part that most nurses building an online presence never think about until it's too late. The platforms already agree with me. Before I show you what that is, I want to tell you one quick thing. I put together a free 3-question scope check that you can run on anything you're about to post. 1 page, 30 seconds. The link is in the description. Grab it and come back, because what's next is worth writing down. Google classifies health content under a framework that it calls YMYL. It stands for your money or your life. Anything that could affect someone's physical health or mental well-being or their financial stability gets held to the strictest standard of review on the internet. So if you post health content, you're already inside that category, whether you know it or not. And when the platforms evaluate whether or not health content is going to get a reach, the signals that they look for follow a framework, and Google spells this EEAT. It stands for experience. Have you actually lived this? Expertise. Are you credentialed in this field? Authoritativeness. Do others in your field recognize you? And trust. Are you transparent, accurate, and consistent? Now let's look back at what he found, because those AI accounts failed every single one of those signals. No real person, so no experience. No credentials, so no expertise. No recognition, no sources, all claims that collapse under one search. They were counterfeiting authority, diplomas on the wall, the professor voice. The counterfeit eventually failed. Meta removed a 300,000 follower account while the camera was still rolling. The enforcement is not theoretical. But I want to be careful with you here, because I've watched people overpromise the next part, and you deserve better than that. Your license does not make you untouchable online, and I know that personally. I knew my scope boundaries cold. I audited my own content before I published, and I still got flagged once because I had bolted safety onto material that was never designed for it. The algorithm does not hand out immunity cards, not even to nurses. Here's what's true. The signals that these platforms are built to reward are verifiable credentials, sourced claims, honest language, a visible path to real care. They're the same habits that your license has been training you into for years. The fake accounts had to counterfeit every one of them. You don't have to fake anything. You have to stop hiding it, and you have to stop drifting past it. But practically, there are 4 habits. And notice that these are not marketing tricks. They're your clinical training made visible. Number 1, cite your source. Not a TikTok, not another wellness account. If you make a health claim, anchor it to a peer-reviewed study, a professional organization, or an established guideline. PubMed is free. An unsourced claim doesn't hold up online any better than it holds up in a chart. Number 2, say what the evidence actually says, no more, such as research suggests, or some studies have found, and so on. The fake account said you will never go to a hospital again. That sentence is a scope violation and a platform violation at the same time, and that's not a coincidence. Your language sounds different because it's honest. The difference is your credential showing. Number 3, keep the path to real care visible. The fake accounts never once pointed a viewer to a provider, and that absence is part of what made them dangerous. But let me be precise here, because this is where it gets misused. Telling people to talk to their doctor is not a magic phrase that makes a risky sentence safe. So if you've already picked the remedy for their symptom, adding the referral afterwards doesn't undo that. The referral belongs where it's honest. You share education. The decisions about their care stay between them and their provider. Number 4, watch the line between education and a clinical claim. An example is, here is how the research describes tonsil stones. That's education. Now, when you say your tonsil stones mean your body can't clear what it should, that's a diagnosis wearing a costume. The distance between those 2 sentences is exactly where your license lived. Those accounts blurred that line because they had no license to protect. You do. So back to his question one last time. Cause for concern or harmless? Concern, real concern, for the people that those accounts reach and quietly steer away from care. But for you, the licensed professional trying to build something online, his investigation is also a map. The words that protect your license and the words that protect your reach are the same words. Not 2 processes to manage, just one of discipline. Those accounts got removed because they were operating outside of every scope at once, clinical and platform together. You already hold the discipline that they had to counterfeit. The work is in building it into your content from the ground up and not checking it after. If you're a licensed health professional who wants to share what you know without crossing the line that puts your license at risk, that's what this channel is for. So start with the free 3-question scope check in the description, 1 page, 30 seconds, run anything you're about to post through it before you hit publish. then subscribe, because nurses and practitioners who understand these rules, they're the ones who get to stay. I'm Rebecca Francis, and I'll see you next time.